But we begin in Lorain, where a major hospital system is ending a program for trauma care.
In just a few weeks, Mercy Health's Lorain Hospital will no longer be considered a Level 3 trauma center.
News 5's Catherine Ross explains what that means for patients and access to care in Lorain County.
These friends appreciate the beach views and central meetup spot in Lorain, but they agree navigating health care in the area can be a challenge.
Getting the coordination of care and benefits is difficult.
Beth Jonup is a Mercy Health patient, and she worries changes coming soon at the Lorain campus could further complicate things.
It upsets me because I think that's more of a business acumen than a personal care idea. I think they just can't keep the hospital staffed.
This week, Mercy Health announced it's not seeking re-verification of its Level 3 trauma program. Since 2019, a partnership with MetroHealth ensured the right staffing and resources to provide 24-hour emergency care for mild to moderate trauma cases.
Keeping that staff available all the time is really hard to do for a smaller hospital.
Mercy Health declined to elaborate on the decision, but says the transition makes sense for both health systems, telling us it will, quote, further Mercy Health and MetroHealth's ability to care for the right patient at the right place and at the right time. Case Western professor of healthcare business J.B. Silver says it likely came down to finances and demand.
If you have that only occasionally, then it just is too expensive to have that standby staff there all the time.
The next closest Level 3 or higher trauma program would be in Elyria, Cleveland, or Sandusky. And Mercy Health does tell me that it'll still be able to accommodate emergency and life-saving care. But some patients worry that they may need to travel for some of the most serious medical needs.
What would happen is you'd get life flighted someplace else, and nobody wants that.
If you're having a heart attack, that's very not good.
Mercy Health wouldn't answer questions about staffing, financing, or its plans for transferring patients needing critical care. But the hospital system emphasized the emergency room in Lorain will remain open, and patients experiencing severe or life-threatening symptoms can still receive care there. Despite the assurances, some in Lorain County tell us they feel like they're losing a resource.
Everybody needs help, and more people need help.
It's changed a lot. A lot of it's for the good, but a lot of it is not so much.
In Lorain, Catherine Ross, News 5.
The Level 3 trauma program will officially end on October 15th.
And Mercy Health says it is expanding elsewhere in Lorain County, including hiring new doctors, surgeons, and adding more specialty services.